Question 24, Honourable Member for Ramsey, Mr Hooper.
Thank you, Mr President. I'd like to ask the Minister for Health and Social Care, pursuant to his answer on the 24th of November, why the island needs fewer whole-time equivalent GPs than in 2016.
Calling the Minister for Health and Social Care to reply.
Thank you, Mr President. The island does not necessarily need fewer GPs than in 2016. There are broadly the same number of GPs on Ireland as in 2016. However, many more GPs are now working less than full-time or working using their skills in extended roles. I'm sure you appreciate, Mr President, that the number of GPs is of course not a static figure. As GPs retire, move, reduce or increase their sessions, and as GPs are also recruited on a regular basis. If we take the actual number of GPs working in general practice on the Isle of Man in 2016, there were 53, 54 if you include the department's salaried GPs. As of this moment in time, there were 48 GPs in general practice and 4 salaried GPs, and there were also vacancies in general practice as well. Practices in the department are actively recruiting to more posts than we had in 2016. GP posts both in the Isle of Man and in the UK can be difficult to recruit to. GP practices are currently looking to recruit to 5 posts, which works out as 3.8 whole-time equivalent. The department is also aware of a number of up-and-coming retirements over the next 12 months. In that respect, the department has worked with the GP profession over the last few months to come to a contract agreement which will work towards ensuring that general practice in the Isle of Man will attract GPs from the UK and further afield to come and work on the island. Work is also underway with Locate IM to attract new GPs and other primary care clinicians to the island. The department plans to recruit additional salaried GPs to be able to support GP practices where there becomes a need for them to recruit. The model of care in general practice is of course evolving. The days of a GP being the only clinician in a practice who is able to provide clinical care is being replaced by each general practice having a multidisciplinary team to provide the most appropriate care for patients. GPs, of course, have a pivotal role in diagnosing and providing good clinical care within practices, but additions to the wider GP practice teams, such as practice nurses, advanced nurse practitioners and pharmacists, have already been made over the last few years, and further additions as part of the Health Service Transformation Programme, for example, mental health practitioners and first contact physiotherapists, subject to Treasury approval, of course, will all be added to the GP practice teams over the next year. This will mean that GP practices will have a variety of practitioners available to treat patients using their particular clinical skills.
Supplementary, Mr Hooper.
Thank you very much, Mr President. I'm not sure that having the same physical number of GPs as in 2016 is any use when actually they're required to work fewer hours. That there is less of a service provision there. I think that statement is unarguable. I wonder if the Minister is aware of a recent BMA report entitled Safe Working in General Practice, which talks about a model with a list size on average of around 1,600 patients. If we were to apply this model to the Isle of Man, we would need the equivalent of 52 working time equivalent GPs, not the 43 that his original answer seemed to imply that we have or are recruiting for. So really, the Minister's mentioned there that he's aware of a number of vacancies today, aware of more vacancies that are going to be appearing in the next 12 months. Is he able to give us an indication of the number of those vacancies, given that we know there are recruitment difficulties in recruiting GPs into practice or even onto salaried roles? And actually, is he satisfied himself that actually within the next 12 months he will be able to roll out recruitment into these vacant roles and also roll out some of these additional primary care services he just talked about? Because the crisis moment is now. We can't afford to wait for transformation to deliver change over the next 4 or 5 years.
Minister to reply.
Thank you, Mr President. Fully agree with the Honourable Member for Ramsey. The moment is now, and that's precisely why we've been working with the GPs on the current contract to make sure it is as close to the UK contract as we can, so people can actually see that there is comparators. So if someone is moving to the island, because that has always been one of the difficulties in the past, people moving to the island and being able to say what they're currently on in the UK to what they will be on when they arrive on the island. The answer in relation to GP practices, though, is the final bit that I said, Mr. President, in that we mustn't just be fascinated with GPs. A lot of the work that the GPs are currently having to undertake shouldn't really be coming across their desk. It should be by things such as advanced nurse practitioners, as I mentioned, the first point, physiotherapists potentially in there, and also pharmacists as well, having the pharmacy within the surgery, people able to be prescribed there and then rather than that all reduces down the risk. The Honourable Member is quite correct around the lists as well, in that the ideal world it will be 1,600. We are a way off that. In relation to that. In fact, I think the nearest practice to that is actually the Southern practice, which is near enough spot on that, with a practice list size per whole-time equivalent GP of 1,602 patients. But then it has a wide variety of ranges all the way up to Finch Hill, which currently has a practice list size per whole-time equivalent GP of 3,194. And it is important that we actually do something to address that. In terms of the current vacancies, I didn't quite get the Honourable Member. I wasn't sure if he was asking about the vacancies coming up in the last 12 months or the existing vacancies, the forward vacancies. Well, I'll give them both actually, Mr. President, and then it's out there. So the current vacancies there's currently 5 vacancies, which is a whole-time equivalent of 3.8. Those vacancies currently are 0.9 in Palatine, 0.7 in Snaefell, 0.9 in Ramsey, 0.9 in Laxey Village Walk, and Castletown 0.4. But one of the reasons we've been working very urgently with the GPs is we are aware that there may be up to whole-time equivalent vacancies of 13.4 coming up in the next year. But that is another reason why the department has been looking to engage salaried GPs within the department, because I think one of the mistakes that's been made in the past, Mr. President, is we haven't necessarily supported the practices. We've treated practices as completely private entities, and we've left them to sort out their own recruitment, and basically said that's an issue for you. By having salaried GPs in the department, we can actually put them into the practices to provide them with additional support during times when they are looking to recruit.
Honourable Member for Middle, Mr. Shimmons.
Thank you, Mr. President. Given that the Minister's just advised us that we need to recruit 13.4 GPs to the island in the near future, how many GPs have we recruited in the last 12 months?
Minister to reply.
Thank you, Mr. President. I don't have that figure, but I will get it and I will have it circulated to honourable members. Although I do need to point out, Mr. President, I haven't said that those are guaranteed vacancies. They are potential vacancies that we may have. The figure fluctuates.
Supplementary, Ms. Edge.
Thank you, Mr. President. The Minister said that they're using comparators with the UK. Perhaps is that the problem, that they don't want to come here if they think they're going to end up in the same situation? And perhaps we should look at a local policy, a solution for the Isle of Man to ensure we've got adequate GPs. But the question I want to ask the Minister, is there any... Is he aware that there's any threat to any other closures of GP practices in the next 12 months due to staffing levels? And also, can he confirm, do the GPs also have to do out-of-hours service in the Meds department at Nobles? Thank you, Mr. President.
Minister to reply.
Thank you, Mr. President. In terms of meds, obviously, it's in terms of the GPs covering it, it's voluntary in terms of that. GPs are not forced to cover meds. We are very grateful to those GPs that do volunteer to do so. Meds would be appropriately staffed by the department, looking at other sources if the GPs are not willing to do so. In relation to any other potential practice closures, no, I'm not aware of any coming up in the next 12 months. In terms of comparators, so when I speak about it being comparative, Mr. President, it means people being able to easily see, because people are used to the UK system of pay for GPs, what they will get if they move to the island. It doesn't mean we keep parity with the UK, Mr. President.
Honourable Member Mr. Robert Shaw.
Thank you, Mr. President. Just for clarity, and given that the guide figure of 1,600 patients seems to be about the right level, am I correct in assuming that that already includes the fact that those practices will have significant support services available? I asked that question because he seemed to be indicating, surprisingly, that we shouldn't be preoccupied with the GPs. We should be looking more at the support services. Could he give us more clarity around his thinking, please?
Minister?
Thank you, Mr. President. I'm not saying we shouldn't be preoccupied with the GPs. It is important that we have the correct number of GPs on the island in order to provide the services that are necessary. But what's equally as important is that we provide those extra services, because the Honourable Member for Douglas East is absolutely correct. When you talk about the 1,600 list, in the UK it does include having, for instance, the practice nurse and so on. But I think here in the island, Mr. President, we should be going further, and we should be looking to do the whole range of services. So we should be, for instance, having a pharmacist in. We have to remember, Mr. President, that the way GP services are delivered in the UK is they're moving towards very large centres for medicine, whereas here in the Isle of Man, I think quite rightly we are sticking with the smaller practices rather than trying to centralise things, and that's the model I think we should keep. But it is important, I'm happy to clarify for the Honourable Member, that I'm not saying we shouldn't be preoccupied with GPs. It's a whole package. We have to be able to get the extra support services in and also recruit GPs as well. And I think if we have those extra support services, it makes it more attractive for the GPs, because if those extra support services aren't there, who's going to end up doing the work as the GPs themselves?
Mr. Hooper, supplementary.
Thank you very much, Mr. President. Really, it's just to build on that question from the Honourable Member for Douglas East. That BMA report that I referenced talks about this concept of a locality hub, which describes all of the services the Minister is talking about being in that one location, and yet it still recommends a maximum list size of around 1,600, which again, based on that report, that structure, which the Minister is very much in favour of, would seem to imply that the Isle of Man would need in the region of 52 GPs, even if we had a fully integrated primary care network that the Minister's vision is for. And yet it still seems that the Department's target for recruiting GPs is in the low 40s rather than in the low 50s, which shows to me there will still be a gap, even if the Minister manages to roll everything out as he intends. Can you please confirm that actually he will go away and revisit the way we fund primary care, but actually in terms of things like the list size, to make sure that patients can get access to a GP when they need one?
Minister.
Thank you, Mr. President. Well, the first thing I have to say, and it goes back to what I said in answer to a question earlier today, we need to do things in stages. And the most important thing is filling the vacancies that we've got and then getting the support services in. Once we've got those additional support services into the practices, then we need to take a strategic look at how many GPs we have across the island, how it's split by surgery in order to be able to deliver the services. This all feeds into the Sir Jonathan Michael review and the recommendations around primary care and the delivery of primary care at scale. Because one of the things that primary care at scale has to deliver, Mr. President, is at the moment we are delivering things centrally that should be delivered at a primary care level. Now, in order to do that, we will need to transfer resource. So it's actually transfer of resource from the centre into primary care, but that needs to be done in a staged approach, Mr. President. We can't just do things overnight. The first stage is recruiting to what we have now. The second stage is actually getting those support services in to ensure that we're delivering modern primary care practice. And then the third stage is then looking at primary care as a whole to ensure that we are delivering what we need to at the appropriate full-time whole equivalent level to ensure that patients have access to the services that they should.
Supplementary, Mrs. Paul Wilson.
Thank you, Mr. President. And just building on that, I wonder whether the Minister could confirm that in order to address the recruitment and the development of services in the primary network, how the funding model is being developed to ensure that there is proper funding moving from the centre to the local primary network. Thank you, Mr. President.
Minister.
Yeah, thank you, Mr. President. That is absolutely crucial. The Honourable Member for Council has hit on a very, very good point, because if the funding model isn't right, then you're not actually going to be able to deliver what you say. So the funding model is under a complete and utter review at the moment as to how we deliver down, because to be perfectly frank, I don't think we've got it right with the funding models in the past. So there is a review currently undertaken in relation, and that forms part of the Sir Jonathan Michael review as well, as to how we actually fund primary care. Because one of the things I noticed long before I was in this honourable court, Mr. President, is particularly when we transferred services to primary care, it was always a case of asking the GPs to take more work on, but then the funding never came with it, and that has to stop. If the GPs take on a service, that funding must go with it to the primary care level.
Mr. Robert Shaw, did you have a final supplementary?
Thank you, Mr. President. I thank Mrs. Paul Wilson for asking the question for me before I got to my feet. Would in the light of his answer, would he fully accept the urgency now of this matter to reassure GP services that they really are no longer the second-class citizen when compared to the acute services?
Minister?
Thank you, Mr. President. I most certainly would, and the Department this year has recognised the acuteness of that. We've been working with the Treasury team, and there were various budget submissions from the Department in relation to primary care put into this budget process, and we, of course, await the outcome of those in the budget process.